Hey guys, Zach Evans here. Quick video tutorial addressing something that I get messages about all the time, especially people just starting out in Romexis that are having difficulty merging intraoral scans with their CBCT, especially in cases where there's a lot of artifact from restorations and crowns. So in cases where we have a lot of scatter, it's sometimes very difficult to be able to merge our intraoral digital models with the CBCT. And you can see that in this case, there's tons of scatter, but if we play with a threshold in this case where there's a fixed bridge, that we can just start to make out little cusp tips that match between our intraoral scan and the CBCT. Critical in these cases that we capture the CBCT in an open bite position. The bite tab is fine. And then we can use these little cusp edges as common data points for merging our CBCT with the intraoral scan. So I like, as people that have taken my courses know, to spread these points out, posterior, anterior, then contralateral, posterior. Also really important that we're catching a CBCT volume big enough and an intraoral scan, hopefully in a case like this that covers the entire arch. And if you have that, even if you have artifact throughout the entire arch, you're most likely going to be able to have a successful scan merge. So really critical in these cases that you do a little quality control. So I know the image is cropped here, but we're going to do a panoramic curve in the maxilla. And that way you can look at your panoramic curve cross sections throughout the entire arch. I always do this, and you can do your quality control to make sure that the merge is accurate, and in this case it's perfect. And I would definitely rely on that to do the guide design and implant. And here's another case. This is an area where we have crowns in the lower right posterior causing a lot of scatter artifact. It's pretty severe on the CT, and you can see how it's really difficult to make out the contours and anatomy of the crowns of the teeth to be able to match that with your intraoral scan. So metal or really dense objects, you can really push that threshold up. You can see that the bone and the teeth essentially melt away, but the really dense objects on the CT are relatively stable. So you can push that threshold way up and you can just start to make out the contours of the cusps. And therefore, as long as we get enough, we can use the rest of the intraoral scan and CT to match up on these natural unrestored teeth, which makes it really easy. So we have the luxury of having a third molar way in the back to be able to merge to. And I recommend spreading these points out as much as you can. Again, just one more reason to be able to capture full arch CT as well as full arch intraoral scans. I think that just enables you to improve the quality of the merge. So really rely on that threshold setting when you are capturing, when you're merging these together. You can push them way up when you're looking at areas that have a lot of that artifact. And like I said, you should be able to have little details pop out that will allow you to merge the two things together. I think on the top of my head, I can think of one, maybe two cases where it just wasn't possible to be able to merge them together. Again, make sure you're doing the CT in an open bite. I have them on the chin rest, but I have the bite tab when I capture my CTs. Anytime I have a patient with teeth, I'm using that bite tab to get the CT scan, and I'm getting a full arch intraoral scan. And if you do that, I think you're going to be successful if you rely on that threshold setting. So good luck. I hope that helps, and I wish you luck, and I hope to see you soon. Thanks. Bye.